Cigarettes, cigars, spit, and pipe tobacco are made from dried tobacco leaves, as well as ingredients added for flavor and other reasons. More than 7,000 different chemicals have been found in tobacco and tobacco smoke. Among these, more than 60,000 chemicals known to cause cancer, carcinogens. According to the U.S. Department of Health and Human Services, in the U.S. alone, 443,000 deaths are caused by cigarette smokers each year. Tobacco use imposes a strain on our healthcare system because one can develop chronic diseases which may cause death and disability. Tobacco not only causes physical harm, but can also create a financial burden with a $193 billion expense rate in healthcare costs along with loss of productivity. According to the Surgeon General's report, long exposure of tobacco increases the risk of developing cancer, cardiovascular disease, pulmonary disease, and reproductive and developmental effects. Over 60 different species of tobacco plants exist today. In the article Forms of Smoking, researchers mentioned that some forms of smoking tobacco are cigarettes, cigars, pipes, hookah, bites, and crotets. And forms of smokeless tobaccos are betel nut, pan masala, and snus.
Tobacco use amongst adolescents has gone down since the late 1990s, but the rate of adolescent smokers in comparison to adult smokers is still higher. This is very shocking and needs to be addressed with a sense of urgency. Adolescents and young adults go through a lot within a time in their lives, and just like most people, there has to be a coping mechanism to help either ease the pressure and pain they may be experiencing. Adolescent and young adults may begin smoking due to stress, pressure from parents to act older or more mature, pressure to peers to keep experience, or to show forms of independence. Adolescents and young adults don't even think about the future health consequences of smoking at such a young age. Television, social media, newsprints, and other forms of advertisements have a huge influence on young adults, and in turn can turn into causing addiction with the target population.
Consequences of tobacco use are all preventative, but for people who are long-term users, may develop cardiovascular disease, COPD, and various cancers such as lung cancer, bladder cancer, pancreatic cancer, and more. More than 90% of all deaths in the United States are caused by chronic obstructive lung disease. Not only will it affect your organs, but it can also affect your reproductive health. Some may experience infertility, low birth weights, preterm delivery, and in much serious cases, SIDS. Every single one of these are preventative, and avoiding exposure to tobacco can help you live a long and healthy life.
Tobacco use has become a concern in the United States, and the citizens of the U.S. have voiced many concerns to the dangers of tobacco exposure. Many U.S. Americans are affected by the prolonged use and exposure of tobacco products. This is not only directed towards the people of legal age to purchase and use tobacco, but also for people younger than the legal age. Many states have enacted laws and provisions to help deter early use of tobacco among many young people. In Illinois and Missouri, the legal age to purchase and use tobacco products is 18 years of age. Anyone purchasing tobacco under the age will face penalties and fines designated by your home state. The federal government has made leaps and bounds not only in regulating the sale of tobacco products, but by also enacting various acts to help deter the consequences of being around smokers. The Smoke-Free Illinois Act puts stipulations on how far you have to be from a building when you are smoking. Also, it prohibits areas in public establishments for smokers. And lastly, when these rules aren't followed, the person and/or establishment may face fines and penalties or possible closure for not complying. Missouri just recently followed suit and started to ban smoking in public facilities and establishments such as clubs, restaurants, and many other public facilities. Even though the federal government has helped alleviate some of the worries of secondhand and third-hand smoke It all depends on you to make a personal effort to prevent the consequences of tobacco use.